Okay, let's dive right into this. Because today we're looking at something we all encounter, but let's be honest, rarely pause to truly dissect. We're talking about the highly condensed, carefully crafted medical advisory. Specifically, we're breaking down a professional pharmacy brief for one of the most commonly prescribed medications in the entire world, azithromycin. Now, what looks like just a simple set of instructions handed to you over the counter is actually an incredible feat of focused health communication. I mean, think about it from the pharmacist's perspective for a second. They've got roughly 30, maybe 60 seconds to deliver critical safety data before a patient mentally checks out, grabs their bag, and just heads out to the parking lot. In that tiny little window, they have to convey exactly what the drug does, what risks it carries, and how to take it safely, all without causing unnecessary alarm. It's this wild balancing act of extreme brevity and super high stakes. And as you'll see, analyzing how this information is structured reveals a whole lot about modern medical communication in this explainer.
To truly grasp the effectiveness of this message, we first kind of have to understand the environment where it's actually delivered. The source material establishes a very specific setting, right? A modern pharmacy completely saturated with these crisp blue and white medical visuals. Now, before a single word is even spoken by the pharmacist, this environment is already doing half the heavy lifting. We aren't just talking about interior design here. We're talking about the actual clinical psychology of trust. Medical environments use these sterile whites and calming blues very deliberately to lower patient anxiety and, well, establish authority. When you walk up to that counter, the aesthetic signals directly to your brain that you are in a controlled, highly professional space. It lays the exact psychological foundation required for effective medical counseling. If the environment felt chaotic or just purely retail, the weight of that medical advice would drop significantly. Instead, the setting primes you, the patient, to listen, to trust, and to actually absorb the critical information that's about to follow.
So, the core subject, the hero of our explainer, is azithromycin, which is also widely known by its brand name Zithromax. Our source gets straight to the point right away, defining it simply and firmly as an antibiotic used specifically for treating bacterial infections. But, for those of us who follow pharmacology closely, we know exactly what makes azithromycin so fascinating. It belongs to a class of drugs called macrolides, and it's famous for its uniquely long tissue half-life. And that's exactly why it's so often prescribed in those incredibly convenient 5-day Z-packs. You basically take the medication for just 5 days, but the drug actually remains active in your tissues, fighting that bacterial infection for much longer, often up to 10 days or even more. By explicitly defining it right out of the gate as a targeted bacterial treatment, the advisory immediately sets the boundaries of what this powerful drug is actually supposed to do. It establishes a crystal clear baseline for the patient before getting into the weeds of exactly how to take it. Just listen to the sheer economy of words in the standard briefing script provided in our source material. It says, azithromycin helps treat bacterial infections. It may cause stomach upset, so always check interactions and follow the pharmacist's advice. I mean, I absolutely love the structure of this communication. In just 2 brief sentences, it delivers the diagnosis confirmation, the primary caution, and the specific resolution. Bam, bam, bam. It doesn't bog the patient down in complex pharmacological jargon. Instead, it completely translates dense medical data into immediate, actionable advice. It tells the patient exactly what the drug is accomplishing, what physical reaction might go wrong during the course of treatment, and exactly who the authority figure is to turn to for help. This is literally the gold standard of clear, concise medical guidance. It ensures that the core safety message registers with the patient in mere seconds, without completely overwhelming them. Let's move on and see how this builds. Because building on that caution, well, no medication is without its potential drawbacks, right? And a highly effective advisory never attempts to hide that fact from the patient. The source is actually very deliberate about highlighting the need to watch for side effects right up front. Now, you might be wondering, why is this absolutely crucial? Because preparing the patient is the single most important factor in medication adherence. Think about it. If a patient experiences an unexpected side effect, their immediate instinct is often to just panic and stop taking the antibiotic entirely. And that knee-jerk reaction, it can lead to dangerous antibiotic resistance or a rapid resurgence of the infection. By putting those potential complications front and center, the pharmacist completely removes the fear and uncertainty from the healing process. It basically changes the narrative from an unexpected, scary event to just an expected, manageable part of the treatment timeline. Now, what's really interesting about this level of specificity is how it empowers the patient. We aren't just giving a vague warning that, you might generally feel unwell. The advisory explicitly points out stomach upset, nausea, and diarrhea as the primary culprits. And there's a really fascinating medical reason for this. Azithromycin actually acts as a motilin receptor agonist. Actually, in simpler terms, it literally stimulates gut motility. It physically accelerates your digestion process. That is precisely why gastrointestinal issues are so heavily associated with it. By plainly stating these documented physical reactions, the pharmacist shifts the patient from being just a passive recipient of medicine to an active, informed participant. If you start your course of azithromycin and suddenly experience a bout of nausea, you don't need to assume something is horribly wrong. You recognize it immediately as a standard physiological response to the macrolide. So how do we handle those potential side effects and ensure the antibiotic actually does its job effectively? Well, the source outlines an essential patient journey, a really strict 3-part safety protocol. Step 1, take as directed. Step 2, check drug interactions. Step 3, follow pharmacist advice. This is the ultimate roadmap to recovery right here. Let's look closely at that second step, checking drug interactions, because it is notoriously overlooked by patients. For instance, did you know that taking standard over-the-counter antacids that contain aluminum or magnesium can actually bind to azithromycin in your digestive tract? Yeah, if that happens, it literally prevents the antibiotic from being absorbed into your bloodstream, rendering it virtually useless. The side effects and efficacy issues are mitigated precisely by strictly managing this process. You don't just take a pill and hope for the best. You actively manage your treatment timeline to ensure it doesn't negatively interact with your daily habits, all under expert guidance. So the crucial point here is this simple, powerful anchoring phrase. Safe use starts with the right advice. This just beautifully resolves the narrative of our source material because it redefines the modern role of the pharmacist. They aren't just retail clerks dispensing bottles of pills behind a counter. They are highly trained clinicians acting as the absolute last line of defense against adverse drug events. They're the ones catching dangerous prescribing cascades, translating complex clinical data into actionable steps, and ensuring that the medication you're taking is actually safe for your specific biological profile. True safety isn't an accident. It isn't just about reading the label on the side of the bottle. It is the direct result of professional, tailored advice that bridges the gap between pharmaceutical science and your daily patient habits. Which really leaves us looking squarely at our own routines, doesn't it? The next time you're handed a prescription, think about the highly structured, careful communication we've explored in today's explainer. Are you asking your pharmacist the right questions before starting a new antibiotic? Are you actively checking for interactions with your daily vitamins or over-the-counter supplements and fully understanding the physiological reasons behind possible side effects? Or are you just grabbing the bag and walking out the door on autopilot? True health literacy starts with you taking that professional advice and rigorously applying it. So ask yourself, are you just taking your medication or are you actively managing your health? Keep asking the right questions, stay focused on the facts, and we'll see you next time.